Now we can discuss about problems and conditions that is treated with the cosmetic surgeries. That there are some important body parts which modified through the cosmetic surgeries include breast, ears, eyes, face, hair, nose, and abdomen. Then the surgical techniques and procedures that is used in these cosmetic surgeries and plastic surgery include first one is liposuction and lipoplasty. Suction means we are sucking and suctioning and removing something, that is of suction. Liposuction means refers to the cosmetic surgery procedures in which the body is recounted by removing the excess stored fat under the skin. Can be from any part of the body. Excessive fat is there, we are suctioning it, removing it, that is liposuction. Especially women, they may have higher percentage of fat than men. Over the buttocks or over the breast or over the abdomen, there is a large amount of fat deposition is there. The individual's body is first injected with a wetting solution which softens the tissue and enables greater quantities of fat and tissue to be removed. We are softening the fat. Before the suctioning it, we are injecting a solution and softening the fat, then removing the fat. Then the fat is aspirated from the body through a needle. Means ultrasound guidance is there for with this ultrasound guidance we are removing the excess fat from the body. And the main areas and main techniques, the lipoplasty techniques involves breast reduction. Liposuction is a primary cosmetic surgery method used for procedures to reduce the breast size. Next means removing fat from the face, then neck, then from the buttocks, then thighs, and from the abdomen. From all this part we are utilizing this procedure, liposuction, and removing the extra fat. Then there are two types of this liposuction procedures. The first one is tumescent liposuction. Tumescent liposuction. The most popular type is the tumescent liposuction, a solution of saline, that is a drug constrict solution of saline, and along with that drug to constrict the blood vessels and some anesthetic agents we are infused into the area. The liquid along with the fat that is sanctioned out of the body using some cannulas, that we are inserting the cannula and we are filling this cavity with, we are injecting a solution of saline, we are injecting solutions to constrict the blood vessels, and through that cannula itself we are removing the fat, aspirating the fat. Then the second type is in ultrasonic assisted liposuction, UAL, ultrasound assisted liposuction. The cannula releases ultrasonic energy. Through the cannula we are providing ultrasonic energy. That ultrasonic energy can melt the fat. Then we are removing the fat from the body. That is of ultrasonic assisted liposuction. And then next procedure is augmentation procedure. Augmenting means we are enhancing something, that is augmentation procedure. This procedure are those in which the implantable devices, already in tissue expansion I discussed about an implantable device. The same way an implantable device or injectable solutions are added to specific areas of the body to increase the size of certain features. Here intention is a cosmetic surgery. Intention is to increase the size of some features like breast. How to increase the size of the breast? For that we are injecting a solution or we are using an implantable device that is called the augmentation procedure. For example, the breast augmentation. Then other areas or body parts that refers to the surgery of augmentation, including the face. Face devices made from a variety of materials that can be implanted to change the shape or contour of the facial features such as the chin, the nose, jaw, cheekbones, etc. That's about the augmentation surgery related to face. Then augmentation surgery specifically for lips. Lip augmentation procedure usually involve only the injection of filling solution. Example, the human fat or collagen. Fat we can remove from the abdomen, and the same fat we can inject to the over that lip, or inject into the lip. Sometimes it's a one-day procedure, one-day surgical procedure. Sometimes it's a non-surgical procedure and it doesn't need a surgical incision to inject the fat. Next procedure is body countering of lift and tuck. Body countering procedures, lift and tuck. You know, tuck means on your churidar and all you putting tuck. If something is excess, we are tucking it. That's the same procedure. Body countering, lifts and tucks. The body countering involves removing excessive, that is loose, sagging skin from particular areas of the body. There is loose and sagging skin, and reshaping and increasing the tone of the skin. Just think about our cloth, chudidar and all. We are shaping it by tucking the extra pieces, extra part we are tucking it. The same way, there is loose, sagging skin is there. We are tucking and reshaping the body. The common body countering procedures that include, first one is brachioplasty. Brachioplasty, that is commonly referred to as an arm lift procedure. Arm lift procedure. Think about the churidar. We are shaping the arm bit of the churidar by putting some tucks. The same way, commonly it involves the tightening and smoothening of tissue and removal of fat from the upper arm, as well as the removal and tightening of the sagging upper arm skin. After removing excessive fat, there is sagging of the skin. We are just removing that sagging skin from the upper arm. Now, next comes lower body lift. Lower body lift involves tightening skin on the buttocks, abdomen, waist, hip and outer thighs. These all portions sometimes after this liposuction procedure, after removing the fat, there is loose skin is there. We are doing this procedure along with this liposuction. What we are procedure, body countering procedure, lift and tucks, we are using our lower body parts. Next comes mastopexy. Mastopexy, that's related to breast. That is commonly referred to as a breast lift. It involves a number of incisions around the areola to reposition it. The counter, we are correcting it and reposition it. We are using this mastopexy. The breast lift may be conducted in combination with the breast augmentation surgeries. Next, I already discussed about thigh lift. Then again, forehead lift. Similar to face lift, discussed about the face lift, there is forehead lift also there. That pulls the skin of the forehead tighter to remove wrinkles over the forehead and smoothen the creases over the forehead. For that, we are using the forehead lift. This corrects drooping eyebrows, then hooded eyelids, then the forehead furrows and frown lines on the forehead. These all are corrected by forehead lift. The eyebrows are also elevated for a more alert and youthful appearance. As you know, once we are correcting the eyebrows, the person may have a youthful appearance. Then next, the brow lift itself. We are just lifting the brow only, eyebrow only. This is some books you can see it. We are doing this procedure along with the forehead lift. That involves incisions in skin around the hairline. It removes skin from the brow or forehead with the aim of reducing wrinkles and sagging skin on the face. Next procedure is the retidectomy. This is commonly known as facelift. Again, that is a facelift. It removes and retones skin on the face with the aim of removing features typically associated with aging. Once there is aging, there is sagging of skin over the face. So an aging appearance, a normal aging process, aging appearance. Sagging is there, then wrinkles are there. Rhytidectomy, we are removing the sagging and wrinkles by means lifting it or cutting the excessive skin. The same way removing the excessive fat. That fat may be removed during the facelift, and means if needed we are keeping some implants also, implant surgery also along with this rhytidectomy we are doing. Next one is blepharoplasty. Blepharoplasty, that is commonly known as a eyelid lift. Blepharoplasty is of eyelid lift. It can involve the upper, lower or both the eyelids. Some are doing the upper eyelid lift, some lower eyelid lift and both the eyelid lift. Then it may involve removing excessive skin to prevent sagging and wrinkles, and sometimes also removing small fat deposits around the eyes. In details, I am discussing about this blepharoplasty, rhytidectomy and all. Next comes abdominoplasty. This is also known as tummy tuck is a procedure. This involves the removal of excessive skin and fat from abdominal area, and often also alters the abdominal muscles to create a smoother appearance with the increased tone. We are improving the tone of the abdominal muscles. This surgery is often performed on females who have excessive skin after being pregnant or after losing significant weight or after bariatric surgeries. Then females after that, once they are pregnant, there is stretching of the abdomen. That after the delivery there is loose skin or sagging is there. Then you can use this abdominal plasty to improve the appearance of the abdomen. The same way, if we are having significant weight loss also, this possibility is there. Then next is procedure, is separate procedure, that is a gynecomastia treatment. That surgery to reduce excessive amount of male breast tissue. That's a condition known as gynecomastia, increased excessive amount of fat in the male breast. This is a permanent treatment, gynecomastia treatment. Then the increased tissues may be due to some genetical problems. Then the men with the large breast, they may require some longer surgery with an additional procedure to decrease the excessive skin. We are removing the excessive fat, the same way we are tightening it by removing the additional skin. Otherwise, the sagging skin is noticeable. Men usually they may not put a shirt. That's why there is chance of noticing that sagging skin. Then usually the surgeons, they will make the incisions around the nipple line so that the scar may not be noticeable. Around the areolar line or nipple line, they are putting incision and removing the excessive fat. Then gynecomastia itself, it conveys no risk for breast cancers and all. Then in some special cases there is some risk for breast cancers later. The next procedure is reshaping. Reshaping cosmetics techniques that involve mentoplasty. That means chin surgery, chin reshaping. Our celebrities, they all are doing this reshaping surgeries. That mentoplasty means chin surgery. Then rhinoplasty means that is of nose surgery. Then otoplasty means the surgery related to ears. Rhinoplasty is clear for you, changing the shape or tip of the nose and all like that. Mentoplasty also means a puffy chin we are keeping or augmenting the chin. That way mentoplasty is there. Still otoplasty means to reduce the size. Big ears are there in order to reduce the size. Then some are malpositioned ears are there, that you have to reposition the ears. During childhood itself we are doing this surgery, the otoplasty. Then next category is of dermabrasion. Dermabrasion is a surgical technique in which the top dermal layers are scraped away. It is carried out with the aim of reducing the appearance of wrinkles and scarring. It may also be medically indicated for the removal of skin cancer. So medically indicated procedure, there are dermabrasion. Next procedure is hair replacement. You all are familiar with hair replacement. You are seeing many advertisements regarding hair replacement. And the hair replacement is a cosmetic surgery procedure that replaces hair lost through balding or as a result of trauma or injury, in which the procedure is usually reconstructive, not cosmetic. Result of injury losses means it's a reconstructive procedure. For aesthetic sense, if you are doing, it's a cosmetic surgery. It involves taking skin from areas with healthy hair growth and grafting to balding areas or areas that have lost the normal hair as a result of trauma.